So another question I get after I diagnosed a woman with pelvic floor dysfunction, they'll say, well, how come that my other doctor didn't find it? The answer really is, I don't know. I didn't train your other doctor, so it's hard for me to tell. So what I usually say is, when you feel like you have some kind of pelvic floor disorder, the most important thing you can do is find a qualified pelvic floor specialist. You can even start with a physical therapist, or you can find a urogynecologic surgeon, specially trained urologist, who can listen to your symptoms, evaluate you clinically, do a physical exam, determine what the symptoms and how they connect to the physical exam are, and design for your treatment plan. If you do that in sequence and properly with the right kind of surgeon, in whom you must invest some time and effort and energy to let them work with you, if you can find such a surgeon who can evaluate you thoroughly, you stand a really, really good chance of getting diagnosed properly. And if you're diagnosed properly, your likelihood of cure is much, much higher. So here at the Pelvic Floor Institute, that's exactly what we do. So if you feel like you have symptoms of pelvic floor dysfunction, can't pee, can't poop, peeing too much, pooping too much, pain with intercourse, chronic pelvic pain, do please come see us here in Tampa Bay. Happy to evaluate you and offer you a diagnosis that you might find helpful. So female pelvic floor dysfunction is a wide catch of symptoms that really have to do with the fact that the muscles that control the pelvic floor functions, incontinence, stool evacuation, stool continence, urinary frequency, urgency, those muscles are out of whack. Those muscles have become injured or hurt in ways either related to childbirth or other situations that can cause injury that lead the patient to have symptoms related to bowel and bladder control problems, pain with intercourse, difficulty evacuating the bowels, difficulty evacuating the bladder. So that collection of symptoms related to the fact that the pelvic floor muscles are not functioning as they should is called pelvic floor dysfunction.